everyone. You found Sanctuary's Coffee and Conversation Show. My name is Myrna Haskell. I'm executive editor of Sanctuary Magazine. This is an online publication for women that empowers and inspires. Our focus is the arts, philanthropy, health and wellness, culture, and community. You can find us at sanctuary-magazine.com. Today, my guest is Marisa Moeller. She is the owner of the Alternative Therapist Partnership, and she provides both cognitive therapy and a variety of alternative therapies to clients. But most importantly, we have an announcement to make. She has a fairly new podcast that has come out. I say fairly new because she's already had lots of episodes, but it's called Radiant Living, Inspiring Humanity to Thrive. So hopefully many of you will check that out. Welcome, Marisa. Great to see you today.
Hi, thank you so much for having me, Myrna. How are you doing?
I'm doing great. And I just wanted to mention, I know a lot of folks that are watching know you because Marisa is an integral part of our community. She's a gold sponsor. She's been on this show many times before. So if you go to our Coffee and Conversation section of our YouTube channel, you can see some past episodes and topics we've done with Marisa. She's been part of our interactive section, Ask an Expert. So she's answered readers' questions on a variety of topics there too. So we very much appreciate her, and I'm so excited to have her on again today. But anyway, so our topic today is naturopathic medicine and the approach to mental health. So I want to start out sort of really general with you, Marisa, because I know that there's listeners out there that are thinking, I never heard of naturopathic medicine. What is that specifically? And so if we could talk about that, how it's used to treat different mental health issues, and just, I guess, start from there.
Sure. Well, first I have to preface everything by saying that I'm not a medical doctor and I'm not a naturopathic doctor.
Right.
But I am a psychologist. I'm licensed and certified in a number of different modalities. I can only speak today to how naturopathic medicine works with psychotherapy or psychotherapeutic techniques. And of course, naturopathic medicine, or naturopathy, as they often call it, is a form of alternative medicine. It covers mostly under the realm of natural or non-invasive or self-healing techniques with regard to treatments for individuals. They do tout natural remedies so that the body will heal itself.
Okay.
That's really what to my understanding, the naturopathic medicine is. Of course, naturopathic doctors, they will have a whole gamut of testing that they do when they see somebody. I work a little differently with it because even though I use alternative methods, more often than not, when the people come to me, I want to say treat the whole person, but from a psychological standpoint. Whereas the naturopathic doctor treats the whole person from the medical standpoint. I have been in contact with naturopathic doctors as well as MDs and psychiatrists. I'm not saying that medicine is never the answer. Pharmaceutical is never the answer, but my preference is not using any kind of medication or numerous medications. So even though I'm in touch with a naturopathic doctor, I'm in touch with a medical doctor, I would like to treat the whole person from a more natural standpoint first.
Okay. And that's dealing with really helping them in such a way that their own immune system and how their body works, all their systems in their body work together to help heal themselves from within, right?
Yes. And well, also, the mental wellness is what I deal with, not necessarily mental illness. Those are two very different things. I like to get someone help when we're still in the mental wellness state, because just like a naturopathic doctor, you have to look at the whole. And similar to a vehicle, we maintain our vehicles, we need to maintain ourselves. So why would one want to get to a point where they're severely exhausted, severely traumatized, severely depressed? We should be working on those things beforehand, because we all have stressors. We have everyday stressors, and it's better to get to someone first before things can get out of hand, because there's a host of issues besides biological hereditary issues that cause what what we term mental illness. I like to look at it as having mental wellness as part of the regime for people.
Yes, in general, mental health, right? So, and what I'm hearing from you is it's kind of similar to dealing with regular medicine too, though, in diagnosing early, right? So that we always hear it's better to get a diagnosis early on so that there's more options as opposed to something being so progressively along that there are less options. And it
Right.
kind of works like that too. I think you dove into this a little bit, Marisa, but just from my end, because I'm not quite so sure. So, helping somebody holistic medicine versus naturopathic medicine. I know holistic, treating
Well, it's
somebody
all the
holistic.
same thing. It's all the same thing.
So it is the same. I
It's
was
all
wondering if there were any differences at
no,
all between the two.
it's all holistic medicine. It's all because of course holistic medicine is dealing with the whole, spelled differently, but dealing with the whole, dealing with body, mind, and spirit. That's really what holistic medicine is. And there are alternative modalities. We use the words alternative modalities, but it is all under the realm of holistic medicine.
Okay.
That's what naturopathic medicine is. But as I said, I'm only qualified to speak from a psychotherapeutic standpoint.
Right, right.
And I use it, even though I'm assuming that naturopathic doctors, they will make reference to a lot of the same things that I do, as far as meditation and yoga and using say vitamins and herbs.
Right. I was just going to ask you that, Marisa, because I think I read about that lots of times if they do prescribe something, it's plant-based or it's natural. It's not like medicines that are made in a lab, for instance.
Right. Now now I will say that there are studies out there that show that the naturopathic medications, the natural herbs work, but they may take longer to work.
Okay.
So it's not that they don't work, they just may take a little bit longer to work than a pharmaceutical lab created medication. Now, I'm not against that because there are individuals that do need that.
Right.
I know it's a
I
very
agree.
yes, I know it's a very difficult subject to discuss mental illness, and a lot of people don't really want to discuss it. But it does happen, and there are individuals. It is a chemical imbalance at times, brought about for a number of reasons. Now, can we address those reasons? We can seek to help them with psychotherapy, hypnotherapy. We can use acupuncture, acupressure. I'm assuming that naturopathic doctors actually also will put that in their tool belt for their
Yeah, I did read that as well when I was looking up, some information on it. Yes, they do.
And that's covering the whole of the individual, assisting them to deal with their perhaps trauma that brought about their unhealthy mental state at the moment that they're in. It could be from depression. So, and I don't take away the diagnostic level of Western medicine. We have wonderful diagnostic tools out there. And I would never say don't go to get any testing done. And nor would I say don't go to a medical doctor. No, that's not the case. In fact, I believe everything has to work complementary, has to work hand in hand. I think that what we're doing is fighting against each other, and we're really doing a disservice to all our clients. There's no reason that they can't be working with everybody at the same time.
Right. And I think that there is a little bit of a move, though. I have a friend who's ill right now who's speaking to, a team of medical professions from all different angles that are working on the problem that this person has, right? So they're looking at the whole person again, but they're also looking at it from different, I guess I want to say maybe categories of medicine so that they can see how they can help the person that way. So they're approaching it from all different types of angles. I wanted to dive in a little bit more specifically into how it can help, as you mentioned, cognitively or, with mental health issues, mental wellness. If you can explain that maybe in a little bit more detail, how that will work.
Well, I can say that from experience, many of my clients have been talked out, talk therapy, Not that it doesn't help them, but they're looking for something else. They're looking for something more. So I personally have included all of the alternative modalities that I've studied through the years. And I specifically went to school to study them so that I could offer many different modalities to my clients, because what works for one doesn't work for the other. And that's not to say that in conjunction, someone comes to me, they haven't been to a medical doctor, they haven't been to a psychiatrist that's issued medication for them, and they're coming to me. I would like to assist them and work together, because I would, number one, I would never prescribe any sort of herbal medicine. I would definitely defer to a naturopathic doctor or a medical doctor, because there are things that are contraindicated, meaning that
Right.
you're on a certain medication and that you take an herb, or vice versa. You're taking an herb and then you go on a medication, a pharmaceutical lab created medicine. They may contraindicate one another. They may cause more issues, or they may render
I'm
them
so glad you brought
ineffectual.
that up, Marissa. You know why? Because I think that a lot of people think, oh, it's, plant-based or it's natural and it's not made in a lab, ergo I can just like take this, doesn't matter what else I'm taking. And I think that's a very good point. No matter what it is that you're taking, that you discuss it with your doctor, the person who's working with you, and say, I'm on this medication, can I do this? Even though I got it in a health food store or I got it from somewhere else. So it's very, very important that listeners understand that all of these things can interact with each other, just like foods do, right?
Yes,
I
yes,
mean, it's just a general knowledge that you have to be conscious about what you're putting in,
yes.
because what you're putting into your body is very, very important, and how those things interact with each other.
Oh, yes, absolutely. And they can do more harm than good. I mean,
And,
what if
and I
they
think I
really,
heard you say that for some people, certain of the alternative modalities may work for one, but not another.
yeah.
How do you approach that? Because somebody might come to you and
Mhm.
maybe they don't know that acupuncture is going to work, but that would be a specific modality that may work, or Reiki or whatever it is. How do you dig into that to try to kind of figure out which modality you think would be most helpful for somebody?
Well, I really let the client, I should say, lead, because, for example, and I think, I'm not sure if I spoke about this with you before, but I know I've spoken with other people about it on different programs. I've had clients that come and they want to try every single thing. And that's just their prerogative. These are the modalities that I offer, and they want to try every one because they want to get well, they want to feel better, so they want to try everything. There are others that come that are fearful and they really just prefer talk therapy, or some that really just want to come for hypnotherapy because they heard through the grapevine that it worked for someone else. So I really let that client lead. And then some come and they say, I've tried this doctor and that doctor, and I've tried this therapy and that therapy, and nothing's worked. And, do you have something different? So I'll just explain the modalities that I work with, and then it's up to them to decide whether they want to try it or not. But it's usually up to the client, because
Right.
some people are more comfortable with one way of therapy, and others are comfortable with another way of therapy. So it's really up to them.
And I think, again, it's that brain body connection, right? Because you want your client to be 100% in, right? Because if you're not 100% in and really wanting to try something to see if you can help yourself, you're starting off the wrong foot, right? You're not springboarding into this new method.
Right.
So could we dig in a little bit to that brain body connection? Because it's something that I truly believe in. I know that, attitude and positive outlook,
Mhm.
and doing things that can help you relax if you are diagnosed with something that's very scary, for instance. If we could just talk a little bit about, what types of relaxation techniques, or techniques that you use specifically maybe in your practice that are related to naturopathic medicine, because that's our topic today, but that you've used in terms of, anxiety, stress. We have so much of this in
Mhm.
our society now, and anxiety and stress seem to affect everything, right?
Oh, yeah.
Any kind of disease you may be
Yeah.
diagnosed with or issue you may have,
Yes. Oh,
it
exactly.
exacerbates things, right? So that whole brain body connection, and how personally you've used it to help clients.
Well, I have to say that many of my clients um, prefer the arts. I have to say the truth, although some have come for hypnotherapy and they do sessions of hypnotherapy, but a lot of them like the more right-brained method where they're not really necessarily thinking about anything. They're just there to relax and possibly meditate on some sort of art-based therapy for them. Sometimes it's only in the process that they find relaxing. You don't have to read anything into what they've created or what they made. There's no necessity for that. Sometimes it's just the act of doing the art that makes them relax. And if that's what relaxes them, then that's fine. There are others that like biofeedback. Biofeedback seems to work very well for people to lower their blood pressure, their pulse rate. It seems to work when people are having panic attacks.
Yeah, can you talk a little bit more about that biofeedback? It's funny that you mentioned it, because I just was reading something up on all these different kind of new, there's a lot of things that are out there that are very new right now. And I know there's also those therapies where you're submerged in water that's, you know, body temperature and all of that.
Flotation tanks.
Yes, yes.
And
is that part of the same thing, or?
Well, the flotation tank actually works with a lot of people that are have a lot of stress and panic. It does, to bring them into some sort of womb or cocoon. Sometimes it's complete deprivation of sight, sound, light, and they're in a tank and they are almost in a womb of sorts.
Right.
You know, the individual has to be comfortable with the treatments that they're getting. They shouldn't be forced into doing something. They shouldn't be forced to continue with a therapist at all.
Right, or a modality that's not working.
Right. Well, the modality is one thing, but even the therapist, I mean, if someone comes to me, they're not comfortable. The bottom line is it's all about them. They have to feel well, feel healthy, feel whole. So if they need to find someone else that works better with them, I'm all for that, because after all, that's really what we're here for. That's why I feel like even with Western medicine, we should all be working together. The reality is it's the client, it's the patient. They're the ones we want to assist them in becoming whole, healthy, healed, really. So it like the biofeedback, for example, and it can be something as a small light that pulses. It could be, especially nowadays, a massive program that one installs on their computer to you know, put themselves into that state with the biofeedback at their home or in a therapy office, because most of us have those treatments as well, and they can have them both at home, and then they can have they can have them in the office and then a version at home too that they continue on with. Some people like it, others don't. They don't like it, but some people do very well with it. It really is up to the client. And
I love that you keep saying that it's up to the client, that you ask the client, because I think that also goes back to mind-body awareness and how the mind can help the body through physical pain even, right? So the person has to be 100% in. They have to be comfortable. I, for one, love the idea of the flotation tank, I think is what you called it, except for the claustrophobic aspect of it. So when I think about it, it makes me feel like maybe I would be relaxed and I could like totally settle blood pressure and all, but at the same time, part of my panic lots of times has to do with more of a lack of escape or a claustrophobic kind of thing. So again, that goes back to what the client is comfortable with, right?
Yes, and I do believe that there are two different types. There's one type, it's really strictly flotation, where you're immersed in some sort of liquid, primarily water, but you're not covered. There are other ones that it's almost like a flotation tank. They're not the same thing. One is open and one is closed. It depends on what facility you go to.
Okay, I didn't know there was one that was open, because I guess I was imagining
it's more or less like you're floating in some sort of water, but you're literally floating with your head above it. There's nothing. It's a quiet room. It's similar to a salt cave, where you're completely enclosed in a room that is quiet with meditative music, and you're relaxed and you're in this water, this liquid, and you're floating. Then there are other ones that have the actual, from what I understand, which are more like a hydro type system where a hyperbaric chamber, you're actually closed in it. That's up to the client what they prefer. There are some people who like that. They want to block everything out from the outside world. And that's why they win this type of hyperbaric chamber.
So you think really the best thing lots of times is a medical doctor, a cognitive therapist, a naturopathic specialist, all of these people from these different angles working together is a good thing because you're looking at somebody's issue from all these different sides?
Oh, sure. Well, remember also stress and depression cause physical disease, physical illness. So that brings with it, very valid issues like high blood pressure, quick pulse rate. So you need a medical doctor to address those things. What if that high blood pressure turns into something that's really serious and volatile? You have to be under a doctor's care for that.
Right.
You can practice meditative techniques, yoga, mindfulness. You can come to group sessions in art and different types of therapeutic modalities. But the reality is what if that blood pressure is not going down? Then you need a medical doctor to be monitoring your wellness as well.
Right, because lots of times with a severe panic attack, somebody who even knows different things they can do, breath work, putting feet up against a wall in an L position, all these different things that we might do to try to lower blood pressure and lower anxiety. Once that episode starts, it's kind of like a runaway freight train, right? With many. Yes. And if that's going to really increase blood pressure on a frequent basis, then you're talking about, really having to look from all angles at what do you need, medication, regular medication, along with all these other things that you try to do to help yourself daily, right?
Right. Oh, absolutely. Absolutely. You can, someone who is suffering from panic attacks, you can teach them a technique to select certain things in a room. You select them, you're talking to yourself and you're picking 5 things and you're repeating it. It's a type of mantra or you're repeating to calm down. But if you're so panicked that you can't even remember that technique,
right?
No matter how many
That's what I was thinking.
Right. No matter how many times you've used it before, no matter how many times you've come to therapy and you've practiced, if you're in this severe panic attack and you can't get yourself out of it, then what damage do you do to yourself? And should a medical doctor view the records and then have an exam with you to see where you can go from there to at least assist you?
Right.
And not every doctor gives out medicine. Not every doctor believes in medication either. I'm not saying that
or they at least don't jump to it right away, right?
Right.
I've been finding actually over the last, say, maybe about 15 years or so, that there are many doctors that want you to try some sort of non-invasive natural something to see if you can control what it is you're working on before they're just ready to write a script. Because years ago, it was just an automatic write a script. So I think, I don't know if it's the training that they're getting or what it is, but I found even with specific MDs and medical professionals rather, that they are going to this. Have you tried this? Have you tried this? Try this before they just want to write a script right away, right?
That's true. And I personally have always found doctors that believe in not only Western medicine, but also a lot of the Eastern philosophies. And I have conversations with them and I'll say, what do you think of this? And sometimes they haven't heard of it. And then I'll say to them, oh, I understood. I read articles about it. And, I've actually had doctors say that they would either look into it themselves, or some will say, well, if it doesn't harm you, if there's no medicine inside it, no sort of chemical that will react and it's harmless, then you can try it. So, you have to also find medical doctors that are willing to listen to you as well.
Right. Absolutely. There's a fit there. I believe that you really, if you're going into a new doctor, you need to do some kind of conversation, intake meeting, interview with them to know it's a good fit. Because if it's not a good fit, you're going to go into an appointment nervous and angsty, right, to begin with, and that defeats the whole purpose. So this is all really good, Marisa, because I think let's review a couple things we talked about, and then I'm going to give you a few minutes to talk about your new podcast, which is fabulous. But So I'm hearing, be careful about anything you take into your body, right? Even if it's natural, right? Make sure that you're comfortable and you're not afraid to say you're uncomfortable with whatever type of modality or thing you're trying to do to try to help heal yourself, right?
Yes.
And then that to always know, first and foremost, that the mind-body connection are very, very connected, interconnected. And that if you're having problems, mood disorders, anxiety, stress, these different things that actually affect your physical state of being, that you have to be cognizant of that and try to find how you can try to help yourself with somebody like you that can teach you and help you along, but that, you know, there are options out there for that before jumping right into a pill, right?
Right.
So, yeah, this is all good stuff.
I do want to say this is the most important thing. I know people think that it might be radical. This is how I personally feel. You are the client. You are the patient. You are interviewing us. That's how it goes. It's your health. It's your wellness. It's your life. It's your wholeness. You are interviewing us. You have to know what we say and agree with it and want to use that therapy, want to try it out, want to go to this particular medical doctor, want to try that particular herb. It's you have to be the person in charge, because without you, we really have, what would we be doing if we didn't, right?
And you know what, Marisa, I don't think that's radical. I think that's excellent advice. And I agree with it. And I hope many out there agree with that. You have to take charge of your health. Sometimes people spend more time looking and researching what kind of new car they're going to get.
That's right.
Than figuring out what's best for their physical and mental health, right?
Right.
So that's very important. So I'm glad you brought that up. Thank you.
And don't ever be afraid to say, this is not working for me.
That's right. I think some people are afraid though.
Yeah.
That's true, because they're afraid, you know, but everybody else said this will work. Why is it not working for me? And maybe I'm stupid if I say it's not working for me. So thank you for that too. Yeah. Don't be afraid to say just what you're thinking, how you're feeling about anything you're trying, right?
Right. I mean, actually, right, because it's a partnership.
Yes.
It's a partnership. We're here to help. But, you know, ultimately, you're looking for what's going to help you the best. And as I said earlier, everything works for one person and everything differently works for another person. It, you know, and then you may try 10 things, you may try one thing. It doesn't matter because we're all individuals. And that's really the most important part, again, is that you are becoming whole and happy, you know, healthy, healed, you know, living your most radiant life. That's really what we all want for each other, really, or hopefully we should all want for each other.
And your Radiant Living new podcast delves into some of this with all your guests. It's weekly. You want to tell listeners a little bit about that, Marisa?
Well, it came about as a fluke. I was talking with someone. We were talking about so much hatred on the planet that we still saw going on, so much destruction. And we were saying, why is it that we're not talking about health and wellness and arts and how arts heal people and how there are people who have used art to heal? Well, and what I mean by arts, I mean art, music, dance, that these things have helped people to heal. And maybe there are other people that are out there that all they hear is the negative. And why should they not hear a lot of the positive? Maybe they need help and they don't even know where to go for help. So I came up with this idea to have a YouTube channel that discusses with shamans and mystics and people that are permaculturing and people that are living green and living on the land and spirituality and the arts and, you know, artists that provide. I had an artist on, she provides, you know, a smile around the world to everybody. And then other artists that have become artists after they themselves use the methods of art to heal themselves. And so that's really how it all started. And it's become pretty popular. It's a weekly, and I've had many different people on. In fact, I'm booked until into 2024 with people. And they're coming on to talk about their issues. You know, there are individuals who have had, one person's coming up was in the military and has had the PTSD, and we've discussed that. That's going to be coming up in the fall. So there's a lot out there to hear.
A real variety of topics then.
Yes, and to help each other. And we wanted to make it positive, where really the ultimate goal is for us all to live a happy and healthy, radiant life. So that's
I love that.
Yeah.
Ergo Radiant Living.
Yes,
right?
yeah. Yeah.
I like that. I like that. So folks, please check that out. We'll put links at the end of the show. But
Okay.
anyway, thank you, Marisa, so much. It's always such a pleasure to do the show with you. I think this is maybe the 5th time we've been on together, which is wonderful. So you can go search for Marisa for some of our other episodes.
Yes,
But
I
I'd
thank you
like to
for having
close
me
as a
again.
yeah, thank you, Marisa. I'd like to close as I always do by wishing all of our listeners and our readers good health, happiness, and continued inspiration. Thank you so much for joining us today.